Substance use disorder describes a category of conditions in which people are unable to stop using a substance despite there being negative consequences or outcomes related to their substance use. Colloquially, it's often called addiction, but to be clear, there is no diagnostically termed word for addiction, at least not in the Diagnostic and Statistical Manual of Mental Disorders, 5th edition, or 5th edition text revision for that matter. Now that I think about it, I think even worldwide epidemiological data, they call it drug use disorder or alcohol use disorder. There are 9 different drug classes for which someone can meet the criteria for a substance use disorder diagnosis. Bear with me, I will discuss these different classes in the very next video. But for now, I just want to kind of touch on what substance use disorders are and their symptoms. Now back to substance use disorder. There are 11, and depending on the drug class, and I'll touch on this too, there are 11, but depending on the drug class, there could be 10 symptoms related to a diagnosis of a substance use disorder. Substance use disorder is when someone has at least 2 of 11 symptoms related to a substance use disorder diagnosis, with these symptoms being, number 1, consuming more of that substance than intended. Number 2, having difficulty slowing down or stopping their use of that substance. Number 3, lots of time is dedicated to obtaining, using, or recovering from the impacts of that substance. Number 4, an intense yearning, a strong desire to use that substance, and this is often described and referred to as craving. So that was number 4. Number 5, the substance is impacting their overall responsibilities. Number 6, carrying on with their use of that substance despite having some pretty consequential and negative outcomes related to their substance use in a social context. So social consequences and harms. That's number 6. Number 7 is stepping away from major aspects of their life so that they can continue to use that substance. Either completely stepping away from major aspects of their life or reducing their engagement in these major aspects of their lives, such as work, other responsibilities, you name it. Number 8, instances of using the substance in situations that could be harmful. Number 9, carrying on with the use of that substance despite them experiencing some negative or consequential physical or psychological outcomes. Number 10, requiring a greater dose or a larger amount just to feel the effect or the desired impact that they're looking for with that substance. Or noticing that with their regular dose or with smaller doses, they're unable to achieve the same effect that they're interested in. This is often called tolerance. And finally, number 11, withdrawal. So withdrawal, again, is stopping the use or cutting down the use of a substance and finding that they're experiencing some symptoms related to either cutting down or stopping that use after they had a pattern of regular, consistent use on that substance. With withdrawal, that's interesting. Okay. With withdrawal, there are 2 drug classes that don't meet the criteria of having withdrawal as a symptom. And I'll describe that as well. Bear with me. I'm rolling this out slowly, just kind of describing each and every component of substance use disorders. Substance use disorders range in severity from mild, moderate to severe. Mild is when someone has 2 or 3 of the symptoms that I described. Moderate is when someone has 4 or 5 of the symptoms that I described. And severe is when someone has 6 or more of those 11 symptoms related to consumption of a substance. In the next video, I'll describe the 9 drug classes that can meet the criteria for a substance use disorder diagnosis. Thank you so much for watching, and I hope you watch the next one.